Good afternoon, everyone. I'm glad and honored to share with you our experience in HIFU treatment of adenomyosis and cystic. We know that this disease now has the trend of showing on the young women with very severe dysmenorrhea. So from this MRI image, we can see high signal of T1, T2. So there are juvenile type, and the other one is adult type, about 30 years old, and similar to the adenomyosis and with some uterine scars history. So when it is a juvenile type, so that is more common, and the drug or medication treatment is feasible, but it's for temporary effects, and surgical treatment will be better. And the lesion section is feasible for young patients. And this is our case of the dysmenorrhea with the score 9 points. So as you may see from this T1, T2 high signal cavity with the severe pain in the surgery. So only we have 250 seconds, but still with satisfactory outcome in this case. So in the 5-year follow-up, and we can see the lesion, the signal reduced. So the adhesion also reduced with the enlargement of the uterine cavity. Another case is a 20-year-old female unmarried with dysmenorrhea with progressive aggravation for 6 years. Plain and enhanced MRI showed a cystic and solid lesion in the left posterior wall of the uterus, which was irregular. And because it is large, so the treatment time is irradiation time is 750 seconds with multiple cystic cavity. And so on the 8th month, we can see the lesion almost disappear, and with no pain and very slight symptoms. Another case is 36 years old, married at 30 and no pregnancy. So every week's examination with the IVF, so with large lesions, so I suggested the GnRH3 injections before the operation. And this is the MRI before the operation. So even after 3 injections of GnRH, there are still a large cavity, sized cavity. And then after the ablation, you can see almost no large cavity, the cystic cavity. So the intramural cavity disappear. For those who receive no HIFU treatment, still you can see the cystic cavity. So we repeated GnRH treatment previously without good satisfactory outcome, but with the HIFU treatment, the outcome is satisfactory with reduction of this cystic cavity. And also we have published and reported on this case. And so for those juvenile patients, it's very important for them because it causes less harm psychologically and physically. And so I think these fighters, soldiers measure the limit with their life. So it's the same with the HIFU people, HIFU surgeons. Thank you, everyone.